So to support the rich human resources of our state, you need to have something equally on par. Therefore, the whole concept of Aster Medcity came about. Aster Medcity is the flagship venture of Aster DM Healthcare. It's an iconic institution of global standards on par with the best. And the vision is that in a matter of few years, it will emerge to be a South Asian center of excellence. The project overall is coming up in 2 phases. What we have now is phase 1. It's a 575-bed quaternary care center. In phase 2, we also have a hotel, a convention center and a township for 10,000 people on campus. So that's the 2 phases. There are some interesting quirks about Aster Medcity. These are very rare elements of healthcare from an architectural and engineering point of view, not seen in many parts of the world and definitely not in India. One important aspect of design element is patient-centered care, where typically when you come into a hospital as a patient, you are lost in the womb of a hospital. Whereas what the attempt in Aster Medcity has been to take the hospital and all its services, clinical services, towards wherever the patient is. Hence, our concept of centers of excellence, what we call 9 hospitals under one roof. So the plan as we have today is to focus on cardiac, orthopedics, neurosciences, oncology, gastroenterology, urology and nephrology, child health, women health, aesthetic and cosmetic aspects. So these are those 9 gems under one roof. Now each one of them, we have designed the program in a manner where it's already benchmarked with the best centers nationally and internationally. Cardiac, for example, covers the entire spectrum of adult and pediatric cardiac work. We have a team of 4 cardiac surgeons and a team of 5 interventional cardiologists fulfilling both the adult and pediatric requirements. When we look at neurosciences, this is truly an outstanding center, not only because of the capable people whom we have managed to attract, but it covers the entire spectrum of complex cranial surgeries, tumor procedures, spine surgeries, interventional neuroradiology procedures. One can count on one's fingertip outstanding centers across the country. Here we were quite lucky that the chief of neurointerventional program has come from one of the top European centers who has decided to come back. Incidentally also happens to be a son of the soil, so he's come back. To support both cardiac and neurointervention, we have Kerala's first hybrid cath lab. Hybrid cath lab, in a very simple sentence, is a highly sophisticated cath lab which is equipped in an operating room facility. So you don't have to shift the patient from this center to the theatre, but if some complication happens, both the surgeons and the cardiologists can work in the same environment. Time is of the essence here.
There are few unique features of care in Aster Medcity at the Cardiac Science Center. One of them is the hybrid cath lab. Now, a hybrid means where you can combine 2 features, that is angiography, angioplasty and surgery in the same sitting. So, Aster Medcity has been equipped with a hybrid biplane cath lab, one of the first of its kind in the region. And this hybrid cath lab enables the surgeon and the cardiologist to work together for the betterment of the patient. Another unique feature which we have introduced is a technique called ECMO. Patient who comes in with cardiac arrest with no blood pressure, no pulse, these patients can be revived using this extracorporeal membrane oxygenator. We will have an ECMO program running, and this program will make sure that such patients with very bad outcome can be rescued with this procedure. And even if the heart is not beating, the brain is kept alive, all the vital organs are kept alive by this ECMO machine. The third feature is this heart team concept. Most often a patient either goes to the cardiologist or to the cardiac surgeon. In this hospital, we have a heart team which takes care of the patient. When you refer a patient to Aster Medcity cardiology, you are not referring to a single doctor. You are referring to a team of doctors. The heart team sits and decides what is best for the patient. And this way again, we can make sure that the patient outcomes are the best and the most scientific in the current world.
One more department which again we are commissioning right now is orthopedics. We have seen the migration of so many Kerala patients outside our state borders either to Tamil Nadu, Karnataka, or even all the way up to Mumbai in Maharashtra. So the attempt here has been to focus on 9 subspecialties, right from a consultant for the hip joint for arthroplasty, somebody for the knee joint, for the ankle joint, sports medicine for upper limb, for the shoulder, elbow, wrist joint, for the spine, pediatric orthopedics and ortho-oncology. So that's a cluster of specialists which we have under one roof in Aster Orthopedics. When we talk about gastroenterology, again we have state-of-the-art services. Eventually in 1 or 2 years time we will go up to having a transplant program, a multi-organ transplant program that will take care of liver, pancreas, small bowel transplant. So that's a vision for Aster excellence in gastroenterology. For urology and nephrology, again we have highly advanced infrastructure all the way from the Da Vinci robot to everything you can think of, whether it's lasers in urology, a comprehensive nephrology program. The Da Vinci robot has a technological USP, again for the first time in Kerala. It's a slave master system where the robot is not an intelligent like a science fiction kind of an object, but rather it's always under the control of the surgeon. And the robot, the greatest advantage of the robot is its ability to move at many degrees, 6 degrees of movement in a very limited space. And it's not only for urology, you can use it for cardiothoracic surgery, for oncosurgery, for gynae oncology, for ENT. So it's a multi-spectrum clinical scope of work for the Da Vinci system. We will be the first center in this part of the world to introduce robotic surgery. Another piece of information is worldwide, when we look at who is the father of robotic surgery, again he is the son of the soil, Dr. Mani Menon, who is a Malayali. He is considered internationally to be the father of robotic urology, and it's our proud association that we have an affiliation with Dr. Mani Menon to train more robotic surgeons under our center.
Here in Aster Medcity, we have the state-of-the-art Da Vinci SI system, which is the first time in Kerala. Patients in this region who largely depended upon the Western countries for this technology now have an opportunity to access this in our own state, and we are all proud of that in Aster Medcity.
When we look at oncology, the burden of a disease such as cancer is quite phenomenal in our state. Multifactorial, it could be genetic, it could be lifestyle changes. Whatever the cause, there is a huge burden of disease. So Aster Oncology in a matter of time will become a comprehensive cancer center. It will be led by a medical oncologist supported by a big team of hemato-oncology subspecialties, pediatric oncology, radiation oncologists, surgical oncologists, covering every anatomical aspect of the body which is of relevance. In infrastructure, we have 2 nuclear bunkers. We are again introducing Kerala's first true beam linear accelerator. It's a highly sophisticated machine which can give precision radiotherapy dose in a very minimal time. We also have a 10-bed bone marrow transplant unit which is getting commissioned. So it's a big team, a combination of human resources, infrastructure, like I mentioned about the other COEs. Our child health program is also something interesting and which we are excited about to offer to our community. We have a whole team of general pediatricians. Then we have a cluster of pediatric intensivists. A couple of our colleagues heading the pediatric intensive care program has come back to Kerala from one of the world's top centers, the Great Ormond Street Hospital under King's College in London. So they have come back. Incidentally, they are also Malayalis, so they have decided to come back home and they are part of the Aster program. We also have a level 3 neonatal intensive care program which will complement their comprehensive pediatric program. So subspecialties in pediatric which we have under Aster Medcity is pediatric cardiology, pediatric orthopedics, pediatric neurology, pediatric oncology. So all these sub-elements are available from day one under Aster Child Health. Going to women's health, again it's a comprehensive center of excellence. We have, even in first year, we have 4 leading consultants. Our chief of OBGYN, the lead consultant, is a high-risk obstetrician. She also happens to be the daughter of Kerala's famous poet, O.N.V. Kurup. She's also trained in robotics. So she has to support her an expert consultant for infertility. We have for minimal invasive work. So that's a whole team which is supporting women health. A dedicated floor is available for women health in which has got its own LDRP suites, theatres and a neonatal ICU which is built on the 5th floor of Aster Medcity. To support all these services, you have a backbone. The backbone of a good hospital, you could say, is intensive care. The intensive care units in Aster Medcity is fairly large. We have 175 beds. Most of our, in fact, all the intensive care beds in Aster Medcity are single base. We don't allow patients to share accommodation. It's single base, designed as per the American healthcare construction guidelines. So when we say a positive pressure room or a negative pressure room, the air conditioning system of the intensive care unit supports. So this enables effective infection control. From a technology aspect, we are fortunate to have a system called ICA. ICA, in a very simple term, is a software which can suck in all the relevant patient information from the monitors, ventilators, to ensure that the doctor and the nurse in an ICU environment can give full attention to patient care. They don't have to waste their time in documenting charts. So that entire wastage of time, which in some case can be as high as 50%, is totally eliminated, and the patient and the patient care team, the doctors and the nurse, can dedicate 100% of their time for the benefit of the patient. That's something rather unique in Aster Medcity. When we also look at support services, whether it's medical imaging or laboratory, we have some of the finest tools available in Asia Pacific region, not just in South Asia. For example, for medical imaging, we have a digital MRI. It's a 3 Tesla unit which has got all the possible softwares for neuroimaging, musculoskeletal imaging, onco imaging. We have a 256 slice ICT CT scan. It has got the lowest radiation dose as per industry norms, so it's of great benefit to patients. We are also the first hospital to introduce something called a 16 slice PET CT in part of a nuclear medicine department. The 16 slice time of flight PET CT is also being introduced for the first time in Kerala. For again supporting the onco program, we have a digital mammo unit. So it's a fairly well structured and comprehensive medical imaging department. The laboratory services have also been designed in a manner that over a period of couple of years, this lab in Aster Medcity would become a reference lab, not just for our own network, but for the entire group.
Dialysis unit at Aster Medcity in Cochin has the latest, most advanced, sophisticated, computerized hemodialysis machines, which make hemodialysis a very comfortable procedure for the patients. We also have a state-of-the-art water treatment unit, which provides ultra pure water for hemodialysis. This ensures that patients do not develop any complications during hemodialysis. Patients are extremely comfortable during the procedure. We have some of the latest machines which are available in the market as of today.
The other support elements which makes Aster Medcity special is our emergency services. The emergency services under Aster Medcity can look after the traditional, for example, we have a fleet of ICU ambulances, we have a water ambulance since we are in front of the Periyar, we have a helipad for air evacuations, and we are also looking at launching the first responder services. These are clinical teams on motorcycles who can manage to tackle the famous KOCHI traffic and provide whatever is required at the shortest time possible. So it's a fairly comprehensive emergency department what we have. Coming into the theatre setup, again we have what we call as an integrated digital theatres. A digital theatre is an environment where a surgeon in an operating field has got ready access to both electronic medical records and medical imaging around his line of sight. So he doesn't have to waste time accessing records, everything is available at fingertips. So that's a highly sophisticated theatre setup which we are introducing for the first time in the state of Kerala. When we look at all these elements per se, I have no doubts that Aster Medcity will go a long way to project our state of Kerala to be the healthcare hub not just for India but for the subcontinent as a whole. There is a dream which Dr. Azad Moopen and many of us share, is that in the next 3 to 5 years the state of Kerala should be able to compete with Singapore. And this element of competition with Singapore cannot happen with just one hospital. All hospitals, whether you're in public sector or private sector, need to join hands. We are always proud of saying that the Ernakulam General Hospital is one of, there are only 4 hospitals in India which is NABH accredited, and the Ernakulam General Hospital is a good example of that. So in our vision, along with the state government and all stakeholders, we need to ensure that all public facilities are NABH accredited at the district level. All the private hospitals also raise quality standards, and together we can make Kerala an international healthcare hub.